Well, as healthcare workers fight to combat the uncertainty of the coronavirus, their mental health may be taking a hit.
News 8's Donovan Long shows us the reality of what they're dealing with.
Hospital workers are under great pressure to slow the spread of COVID-19. Some telling me tonight that caring for patients, protecting themselves and their loved ones is taking a toll on their mental health.
It has been very different than anything I've experienced in the ER.
Stress mounting for Metro Health hospital workers fighting to flatten the curve while also shielding their families from harm.
They are concerned about their spouses and their kids at home and bringing the potential virus back.
Kalamazoo nurses are familiar with this struggle, several going great lengths to keep COVID-19 out of their homes.
I actually sent my children away. I don't want them around me when I could possibly be asymptomatic and expose them. And that's what a lot of nurses are doing. Some are sleeping in their garages in tents.
Critical care nurse Jamie Brown says fighting the outbreak is rough on all medical professionals. To make matters more intense, she says some of her fellow nurses in Kalamazoo are being asked to consider helping in Detroit hospitals.
Right now, it's volunteer request. However, we're only being offered $2 more an hour to go and put our life at risk.
As medical professionals work to care for sick and even dying patients, psychologists urge them to speak up if they too are suffering.
We want them to have a connection person, and maybe that's just a safe person in their own lives, but it could also be a mental health support.
Experts say spouses and even kids can give hospitalists the support they need.
It's really good for family members just to be checking in to say, hey, what do you need right now? What can I do to be there for you? What can I do to help you?
Above all, nurses and doctors are glad to help and call on everyone in scrubs and white coats to have mercy on each other.
Give each other grace and keep smiling.
Nurses and doctors are united in this fight and encourage anyone who is nearing their breaking point to get help immediately. Reporting in Grand Rapids, Donovan Long, News 8.